So what forms do you compound LDN in your Strive pharmacies?
A number of different forms. To be quite honest with you, the flex dose tablet is going to be probably the one that's used most often. The fact that it's able to split so easily to help with titration is a fantastic option. We compound it as a capsule form as well. So patients are, doctors or providers are able to kind of customize the dose for the patient. We compound it topically. Also, there is that option. Megan, do you have any other input on ways that you've seen it compounded?
No, I mean, but just to add on to the topical dosage form that you mentioned, I usually recommend the topical specifically for dermatological conditions like eczema, psoriasis. It's also good for vaginitis too, as well. If you're looking to get systemic levels of naltrexone, topical is not your best way to go, especially on the pediatric level. Pediatricians will reach out and concern over the ability of children to take medication. And so they inquire if a topical dosage form would be a good option. And unfortunately, it's just not ideal in order to really systemically get those results that we're looking for. But I do love topical for all different types of dermatological needs.
And you did mention children, and with the flex dose tablet, Megan always likes to point out that once it's split, it is a very tiny tablet, but we can make it as a liquid as well for those patients who are, who are unable to swallow a tablet. So
Are
pointing that
your
out.
flexi tablets sublingual or are they just a standard tablet?
Yeah, it's not a dissolving tablet. It is meant to be an oral dosage form, but we are able to make naltrexone in a sublingual liquid dosage form if the patient and the provider would prefer that. So that's also an option.
Because it's absorbed differently, it bypasses the stomach, doesn't it? So when Dr. Jill Smith did her Crohn's study, she actually used the sublingual with the Crohn's. And we also learned at that point, because before then, it was you couldn't take LDN with steroids. And of course, with her trial, she actually used steroids. So it was like, okay, we can use LDN with steroids.